1. Which of the following is an essential component in creating an effective oncology nursing curriculum? A. Focus on advanced technical skills. B. Emphasis on interdisciplinary teamwork. C. Exclude patient perspectives. D. Use of outdated resources. 2. Which communication strategy is most effective in educating cancer patients about treatment options? A. Providing written materials only. B. Using technical jargon to explain procedures. C. Engaging in two-way dialogue and active listening. D. Limiting discussions to the medical team only. 3. What is the primary goal of adult learning principles in oncology nursing education? A. To promote memorization of facts. B. To facilitate the development of critical thinking skills. C. To ensure patients understand treatment options only. D. To focus solely on clinical procedures. 4. In a mentoring relationship, how should an oncology nurse best support the growth of a mentee? A. By providing feedback on clinical performance only. B. By offering guidance on personal development and career goals. C. By avoiding feedback to prevent discouragement. D. By focusing solely on technical skills. 5. Which of the following best describes a method for assessing the effectiveness of an oncology nursing education program? A. Pre- and post-tests to measure knowledge acquisition. B. Only using participant satisfaction surveys. C. Relying solely on theoretical exams. D. Ignoring participant feedback. 6. Which is a critical element for ensuring compliance with oncology nursing regulatory standards? A. Regular training on new guidelines. B. Ignoring updates to regulatory policies. C. Focusing on clinical practices only. D. Limiting education to senior staff only. 7. What is the most effective method for evaluating the effectiveness of a cancer treatment education session? A. Observing patient participation and feedback. B. Conducting a multiple choice exam after the session. C. Relying on instructor self-assessment. D. Limiting patient interaction during the session. 8. How can oncology nurses best support patient autonomy in decision-making? A. By making all decisions on behalf of the patient. B. By providing clear information and supporting informed choices. C. By discouraging questions to streamline the decision-making process. D. By focusing solely on physician-driven decisions. 9. What is an essential strategy for managing the emotional challenges that cancer patients often face? A. Dismissing emotional concerns as unimportant. B. Fostering open communication and providing emotional support. C. Providing only medical information without addressing emotional needs. Encouraging patients to be independent and avoid emotional expression. 10. What is the most effective strategy for fostering a positive patient-nurse relationship in oncology care? A. Maintaining a professional distance and avoiding emotional involvement. B. Establishing trust, offering empathy, and providing consistent support. C. Only addressing medical concerns and avoiding personal discussions. D. Limiting patient contact to scheduled appointments. 11. Which of the following strategies can oncology nurses use to manage their emotional well-being? A. Ignoring their feelings to maintain professional distance. B. Seeking support through peer groups and professional counseling. C. Avoiding communication with patients to protect their emotions. D. Limiting interactions with families to avoid emotional attachment. 12. What is the key benefit of using patient-centered care in oncology nursing? A. It leads to better patient satisfaction and improved health outcomes. B. It focuses solely on reducing the cost of care. C. It eliminates the need for patient education. D. It restricts patient involvement in decision-making. 13. How should oncology nurses address the unique needs of pediatric cancer patients? A. By using adult cancer care strategies without modification. B. By employing child-specific communication techniques and age-appropriate interventions. C. By ignoring the emotional needs of children in favor of medical care. D. By minimizing the involvement of family members in the care process. 14. What role does interdisciplinary collaboration play in oncology nursing? A. It ensures comprehensive care by integrating input from various healthcare professionals. B. It complicates care and should be avoided. C. It is unnecessary for non-critical patients. D. It only involves the nursing team without other disciplines. 15. Which of the following is a key factor in evaluating the quality of oncology care provided? A. Patient feedback, clinical outcomes, and staff performance. B. Only clinical outcomes. C. Only patient satisfaction surveys. D. Only staff performance reviews. 16. What is the most effective way to address the nutritional needs of oncology patients? A. Providing standardized meals without individual adjustments. B. Collaborating with dietitians to tailor dietary plans for individual needs. C. Ignoring patient preferences to ensure strict adherence to medical guidelines. D. Offering only liquid diets to all patients. 17. What is a key strategy for oncology nurses when providing care to patients undergoing radiation therapy? A. Ignoring skincare to avoid unnecessary interventions. B. Providing detailed skincare instructions to prevent adverse effects. C. Relying solely on physician orders without offering additional care. D. Limiting patient education to only the treatment procedure. 18. How should an oncology nurse handle a situation involving a patient's noncompliance with treatment? A. By reprimanding the patient and enforcing compliance. B. By engaging in open, non-judgmental conversations to understand the patient's concerns. C. By discontinuing treatment and dismissing the patient's concerns. D. By ignoring the patient's preferences to enforce treatment compliance. 19. In oncology nursing, what is the best approach for managing patient pain? A. Ignoring patient reports of pain to focus on clinical procedures. B. Regularly assessing and adjusting pain management plans based on patient reports. C. Relying only on strong pain medications without considering alternative methods. D. Focusing solely on addressing pain at the end of treatment. 20. What is an effective method for oncology nurses to assess a patient's understanding of their treatment plan? Asking the patient to recall specific medical terms verbatim. B. Having the patient explain the treatment plan in their own words. C. Relying only on written materials without verbal verification. D. Ignoring the patient's ability to understand and focusing on clinical outcomes. 21. How can oncology nurses best support the psychological well-being of caregivers? A. By ignoring caregiver needs to focus solely on the patient. B. By providing counseling services and resources to caregivers. C. By encouraging caregivers to manage on their own without support. D. By dismissing caregivers' concerns to avoid patient distraction. 22. Which of the following is the best approach when delivering bad news to cancer patients? A. Providing only clinical facts without addressing emotions. B. Using clear, compassionate communication and providing emotional support. C. Avoiding direct communication about prognosis to maintain hope. D. Minimizing discussions of treatment outcomes to prevent patient distress. 23. What is an essential strategy for enhancing communication with oncology patients who have hearing impairments? A. Ignoring their hearing needs to avoid embarrassment. B. Using written communication and visual aids. C. Speaking loudly without considering their hearing aids. D. Relying solely on verbal communication. 24. Which of the following best describes a nurse's role in managing oncology research data? A. To ignore research findings that do not match clinical experience. B. To integrate research evidence into clinical practice. C. To focus solely on personal patient experiences without considering research. D. To disregard research studies that conflict with institutional guidelines. 25. What is the most effective way to prevent infections in oncology patients? A. Ignoring hand hygiene protocols to save time. B. Strict adherence to infection control procedures and education. C. Relying only on antibiotics after infections develop. D. Minimizing patient monitoring during chemotherapy. 26. How can oncology nurses contribute to the development of evidence-based practice? A. By solely relying on their personal experiences without considering research. B. By engaging in ongoing research, collaboration, and professional development. C. By avoiding the use of evidence-based guidelines in daily practice. D. By limiting practice improvements to administrative tasks. 27. What is an essential component of an oncology nurse's role in patient discharge planning? A. Focusing only on the patient's immediate needs, without considering long-term care. B. Ensuring the patient and family understand post-care instructions and resources. C. Ignoring the needs of the family to focus on the patient only. Disregarding patient preferences to ensure efficient discharge. 28. How can oncology nurses support patients during end-of-life care? A. By avoiding discussions about death to maintain hope. B. By providing compassionate care, including emotional and spiritual support. C. By focusing solely on pain management without considering emotional needs. D. By encouraging patients to avoid discussing their concerns. 29. What is a primary goal of oncology nursing in palliative care? A. To cure the disease at all costs. To enhance comfort, relieve symptoms, and improve quality of life. C. To avoid addressing the emotional and psychological needs of patients. D. To focus only on treatment without providing holistic care.